And all new for you tonight at 11, a healthcare journey coming full circle at OCH Children's Hospital. Meet Dr. Jessica Canallatos. She was born with a cleft lip and palate, and now she has dedicated her career to caring for those who are experiencing the same thing that she did. A cleft lip and palate occurs when the tissue making up the upper lip doesn't join completely before birth, leaving an opening. Now, according to the CDC, about 1 in 1,600 babies in this country are born with a cleft palate each year. Treatment typically involves surgery, which is where Dr. Canallatos comes in. I met with her at OCH, where she shared her first full circle moment story with me, alongside the surgeon and nurse who inspired her career. OCH Children's Hospital's Craniofacial Center is home to trained professionals and is nationally recognized as an American Cleft Palate Craniofacial Association approved team. One of its newest hires is a provider who used to be a patient for many years.
Was about 3 months old when I had my first procedure, and that was to repair my cleft lip.
Dr. Jessica Canallatos is a prosthodontist. She tells me she had about 10 to 12 surgeries for repairing her cleft lip and palate, and most of those surgeries were done by Dr. Robert Perry.
Saw her from birth and got to know her and got to know her parents. I've had a number of patients who have had cleft lip and palate, and she was one of the ones that I followed through multiple surgical procedures.
I also took care of her in the operating room. I was the circulating nurse in her surgeries because I worked with Dr. Perry in the operating room prior to this position.
Her post-surgery follow-ups took her from birth through the age of 29, which was about 6 years ago.
So it's very fresh in my mind, so I'm very close to being a patient. So it actually helps me with treating these patients because I was just there.
Now, as a prosthodontist, which is a dentist who specializes in treating complex dental and facial matters.
Going really well. I have my own lab here that I make my prosthetics in, and I have a wonderful medical assistant and a great team to support me.
She now gets to work closely with Dr. Perry, who was still on the team today, along with Jan Rockwood, head of OCH's Craniofacial Center Patient Care.
Anytime I would visit in the craniofacial clinic, Jan would come in. She had the best energy. She still does. And she's just a light for these patients, for me. Dr. Perry, when he's working, it's like he's creating a work of art. He'll just stare at your face, move things around with his hands. You can just tell he's so good at what he does. And I liked that he just seemed like he knew what to do. And I wanted to be a provider who knew what to do.
And while Dr. Canallatos says that her journey from patient to provider inspired her to give back, Rockwood says her new colleague is who inspired them.
She is the inspiration to us to continue to care for these children affected with cleft lip and palate and other craniofacial concerns. And she just makes us better in so many ways.
Now, Dr. Jessica Canallatos has been on the staff at the clinic since January.